today our report on the global resourcing of harm reduction, and the title says it all, 3 cents a day. Clearly, the people who are funding harm reduction are drug users themselves. They're spending more themselves on drug treatment, drug services, needles and syringes. The amount of money being spent is probably somewhere between just a 14th or a 20th of what really needs to be spent. So there's a huge global funding gap.
And it's when you look at these programs in terms of the global numbers that you realize that only few injecting drug users are actually able to benefit from these services, which have been proven substantially to work very well. So I think it is important to reflect on the fact that programs do work, it's just they do need to be scaled up significantly.
We should recognize that harm reduction right now is by and large a thing that is established large scale in the rich or in the developed world, but definitely harm reduction works everywhere. We do have proof for that, regardless the socio-economic setting, regardless the policy of any one country where harm reduction has been implemented, it works. However, if you look at the coverage figures, meaning how many people do have access from those who should have access, then we are speaking about disappointing global figures. And the Global Fund here is certainly an accessible donor, and this is certainly also demonstrated by the $180 million that we dispersed already for frontline harm reduction services in the period from 2004 to 2008. Now the challenge will be to work with the countries to help them that they are applying to the Global Fund, yet also to other international donors for a substantial increase in their harm reduction services that they want to implement within the next couple of years. And every 10, 20, 100, $200 million that will be secured for that purpose now will be translated into services in the next 5 years.
There's a shortfall in the money going to harm reduction, and we need more of it. But at the same time, it's important to understand that most of that money is coming from HIV/AIDS budget lines that are under pressure now, as many of the donors are wanting to move to a broader health systems approach. And what implementers are telling us on the ground is that will only be useful in terms of reducing the health impact of drug use if under that health systems umbrella and funding we set specific targets that are around HIV and the health needs of people who use drugs. It's important to understand that many of these healthcare settings under the umbrella of catering for the health needs of drug users are really running detention centers where mistreatment and even torture is happening under that label. These are the very health systems that we're saying that we're going to strengthen. Well, they can only work for drug users if those centers are closed down.
And the challenge to the global community is to meaningfully involve people who use drugs in policy discussions, in the delivery of services, and in the allocation of funding. We are entering a period where people who use drugs will no longer be framed as the problem, but recognised as key partners in finding the solution.
And for us to understand and be clear about what harm reduction means for young people and what drug treatment means for young people, we need to be clear in the definition of that. And so we want young people to have access to needle exchange. We want young people to have access to HIV prevention, care, and treatment. We want young people to have access to substitution therapy. What we don't want is that we don't want young people to be beaten. We don't want young people to go and work, for free labor. We don't want young people to be molested and abused. That's not drug treatment. And so when we stop being liberal about our definitions around what drug treatment means, and we find alternative solutions and comprehensive solutions where young people are getting comprehensive education, we're doing alternatives to incarceration. Those are the types of things that allow and give young people the opportunity and the spaces to say, I can express myself freely, I can grow into a person who loves and cares and can build relationships with people. Those are the kinds of things that we want for young people to develop, because we want them at the end of the day to be a part of the society, to be human. Those are humanistic things. So at the end of the day, Youth Rise is here to promote that.